Hi friends, as promised, today I am going to talk about age-related macular degeneration or ARMD. This is an eye disease that affects the macula, which is a central part of the retina responsible for sharp vision. It happens when people get older, and because it affects the central part of the retina, it has an impact on activities like reading and recognizing faces. There are two main types of ARMD. The first one is dry ARMD. This is more common and happens slowly as the macula thins over time and tiny clumps of protein called drusen grow. The second type is the wet ARMD. This is less common but more serious. Here, abnormal blood vessels grow which cause leaking into the retina and a faster vision loss. Now let us first see how the eye works and how it enables us to see. So the eye works like a digital camera. It works like a digital camera in several ways. The cornea acts as a main lens, focusing light into the eye. The iris controls how much light enters by adjusting the pupil like a camera's aperture. The crystalline lens fine-tunes focus, helping us see objects at different distances, similar to an autofocus function. The retina captures light and converts it into signals like a camera sensor. These signals are sent through the optic nerve to the brain, where they are processed into images. The retina has two main parts. The first part is the central part of the macula. This is responsible for a detailed, sharp vision and color perception. It helps us read, recognize faces, and see things in sharp details. The second part is the peripheral or the side vision. This helps us detect movement, see in dim lighting, but it does not provide sharp details like the central vision. Many people do not know they have ARMD until their vision becomes very blurry. That's why regular checkups with an ophthalmologist are very essential, because they will detect ARMD before your vision starts to deteriorate. So who is at risk for ARMD or age-related macular degeneration? Number one, if you have a family history of ARMD. Number two, if you are over 50 years old. Number three, if you have a lighter color of the iris, blue-eyed or green-eyed. Number four, if you are overweight. Number five, if you have high blood pressure or hypertension. Number six, if you smoke. Number seven, sun exposure can increase the chances. Number eight, nutrient deficiency. Deficiency of antioxidants like vitamins C, E, and particularly lutein and zeaxanthin found in leafy green vegetables, as well as zinc. Low levels of these nutrients are associated with an increased risk of developing AMD. Number 9, if you eat a lot of unhealthy fats found in foods like meat and butter. Number 10, ARMD is more common in the white population. So for the diagnosis of ARMD, there's the Amsler grid examination, a detailed retina checkup, an OCT of the retina, and sometimes a fluorescein angiography of the retina. Amsler grid examination. During an eye examination, your ophthalmologist may show you an Amsler grid. This helps check for blurry, wavy, or missing areas in your vision. Number 2 is a detailed retinal examination. Number 3 is the optical coherence tomography or OCT. It is a special scan that gives a detailed look at the retina. It uses a machine to take clear images of the retina and macula. Number 4, your doctor may do a fluorescein angiography to check your retina. A yellow dye is injected into a vein, usually in your arm, and as the dye moves through your blood vessels, a special camera takes pictures of your retina. This helps the doctor to see if any abnormal blood vessels are growing under it. Treatment. For dry ARMD, some injections are available to slow the geographic atrophy. There is no treatment for drusen, however. People with lots of drusen or serious vision might benefit from taking these vitamins like vitamin C, vitamin E, lutein, zeaxanthin, zinc, and copper. Also, beta-carotene should not be used by smokers as it can raise the risk of lung cancer. Eating dark leafy greens is definitely very beneficial, as is eating yellow fruits and veggies. Fish is a very important part. Fish is very important in the treatment, and a healthy balanced diet can help people with ARMD. Now for the wet ARMD treatment, certain medications like the anti-VEGF drugs. So anti-VEGF treatment helps reduce the number of abnormal blood vessels in your retina. If you have ARMD, you can continue doing your activities using the low vision aids which I mentioned in my last post. So they are magnifiers, the other optical aids, the electronic tools. So you can incorporate these gadgets in your daily life and continue doing the activities that you were doing before. Now we talk about the Amsler grid. So Amsler grid examination should be done. If you are suffering from ARMD, you should incorporate this daily in your routine. So here is the method of how you do it. Check your vision with the Amsler grid. ARMD can slowly change your vision and you may not notice it right away. Catching these changes early can help protect your sight. Use an Amsler grid every day to check for any changes in your vision. Keep it handy. Keep it at a place where you can see it every day so that you don't forget. In a good lighting, hold the grid about 12 to 15 inches away. Wear your reading glasses if needed. Cover one eye and look at the dot in the center with the other eye. Check if any lines look wavy, blurry or missing. Cover the other eye and repeat the test. Consult your ophthalmologist right away if you notice that any lines or parts of the grid look wavy, blurry or dim. While ARMD can affect your vision, early detection and a healthy lifestyle can help slow its progression. Regular eye checkups and simple daily habits can make a big difference in maintaining your eyesight. So keep watching for more videos like this. Stay tuned and have a wonderful day. Thank you.